I'm delighted today to speak about the role that simulation plays in medical education, a role which was definitely accelerated and augmented by the COVID-19 pandemic. And I'll be focusing on some of the actions taken at RCSI Bahrain in that regard. But I first want to start off by thanking all my colleagues who I've had the opportunity to work with over the last year, particularly everyone who was involved in responding to the challenges posed by COVID. So, over the next few slides, we'll be touching briefly on simulation in healthcare and healthcare education before going into details of how RCSI Bahrain responded by shoring up simulation capabilities and what that means for our faculty and our students. So simulation was initially developed by the high-risk airline industry and the military to train pilots on flight simulators. And to this day, pilots still undergo numerous hours of training on simulators before ever flying a real plane. And as early as the 1970s, simulation principles and practices found their way to the equally high-risk healthcare industry, with various applications ranging from education to drug discovery, in which simulation has helped speed up the process and reduce costs. And it also has applications in healthcare management by helping to map out patient pathways and identifying bottlenecks in hospital processes. So when it comes to education, simulation has been utilized across four main domains: those of teaching, assessment, research, and health systems integration. And at RCSI Bahrain, it's been increasingly used in teaching and assessment in particular since the onset of the pandemic. Now, the obvious appeal of simulation lies in allowing students and physicians to gain confidence and proficiency in delivering medical interventions and learning technical skills without the risk of inflicting patient harm. And this is done by practicing on mannequins for technical skills and learning clinical judgment with simulated patients and mannequins as well. Now, the other appeal is that when you compare learning through simulation with learning clinical rotations, in simulation, it's a very active learning process, and this allows students to develop their clinical judgment, their decision-making skills, and their team competencies when they're actively managing a simulated case. And this really complements the process of learning by observation that students do in clinical rotations. So why simulation? What are we getting out of it? And is it really worth the effort and investment? And the short answer is yes, it is, because what the research has shown is that simulation, particularly focused on critical settings, which is one of the main focuses of simulation sessions at RCSI, significantly reduces medical errors. And that's because the communication and coordination skills, which are tackled well by simulation, are actually, according to the IOM report, the #1 cause of medical errors. And then it also improves technical skills and allows for identification of performance gaps. And here students are actively involved in reflecting on their own performance, and so this improves their reflective skills as well. And this is essential for their development into mature physicians. In terms of how students perform in exams, a recent Chinese study actually showed that students trained with simulation techniques do better than their peers in OSCEs, and so we're hoping to see better grades this year. Now, when we look at the foundations of simulation, there's an ongoing debate in the literature between researchers who are trying to prove that technology is the most essential component of simulation, and other researchers who and educationalists who think that methodology is more important, or that it matters more for delivering effective simulation-based teaching. Now, when we look at the reality, though, both technology and methodology complement each other and enable the delivery of high-level, effective simulation-based teaching. But to reach the highest level of impact, it's very important that simulation sessions are fully integrated into the curriculum. Now, what this slide shows is the entire spectrum of technologies used in simulation, from task trainers and low-fidelity mannequins all the way up to high-fidelity mannequins, standardized patients, and of course hybrid techniques that combine both. And what's highlighted here in red is the range of technologies that are available at RCSI. So we pretty much have things across the range, and that's very important because high fidelity doesn't always mean better. High fidelity mannequins are well equipped to run complete clinical scenarios with physical examination findings, procedural skills practice, and administration of medications, and so on. And the mannequins that were acquired recently can deliver a huge range of scenarios across multiple specialties. On the other hand, you got things like task trainers, which are well suited for some procedural skills, such as catheterizations and cannula insertions, etc. And they're lower in cost, so you don't abuse your high-cost items. That's because the task trainers don't require significant technological capabilities. Now, this is just an example of a high-fidelity ultrasound simulator mannequin that was recently acquired by RCSI, and it's specifically programmed for obs and gynae. So that's the technology component. Now, in terms of methodology, the process of simulation is really a cyclical one, and it starts with planning the simulation session, pre-briefing, followed by running the simulation, and then debriefing. And debriefing is really the part where the light bulb usually comes off, and so it's the focus of simulation teaching methodologies, because there are multiple ways to do debriefing, and you may require a combination of these techniques to really deliver the most effective teaching. Now, following debriefing, an evaluation of the learning and the learning activity is done, and this is used to improve on the simulation scenarios. And this process is followed at RCSI both before and during COVID. This slide shows the 2007-2009 update on Benner's original framework for simulation training for faculty, and it categorizes people's abilities as trainers into levels, from level 1 with basic technical training all the way to experts who train trainers. And at most simulation centers, the faculty will usually hover around level 1 or level 2, but we're lucky here to have support for courses that have been conducted and continue to be conducted that promote the continuous development of faculty into level 3 and beyond. So with this, I'd like to go on, just talk a little bit about what has been done and what is still being done at RCSI Bahrain in terms of simulation. So first, there was a huge investment in technology, and we acquired a lot of high-fidelity mannequins, computer-based simulation, and a variety of different task trainers to allow hands-on teaching of physical examination, procedural skills, and developing clinical judgment. And this had a huge role to play in terms of compensating for the reduced clinical access. The other thing that's been done is an increased utilization and training of standardized patients who are used both in teaching and assessment. And the advantage here is that they provide direct feedback to the students, and this allows them to improve their history-taking skills and their clinical judgment. And an additional part of the response to COVID has been the ongoing development of the simulated patient unit. And here I really want to acknowledge the huge efforts by Dr. Naji Alamuddin and by Yoga and Jackie in this project for developing the simulated patient unit. So on the left here we got the SAM 3G mannequin, and this is a high fidelity auscultation trainer. And on the right you can see one of the students practicing on one of the recently acquired ultrasound-based central line insertion simulators. And it's very realistic, and even the haptic feedback of it is also very realistic. Here we can see Prof. Jim. You can't see it behind his mask, but he's very happy with the ultrasound simulator, the obs and gynae ultrasound simulator. And this really opens up the door to students, because even with full clinical access, it's unlikely that the students will be this involved in obstetric ultrasounds and in learning about the different findings at this level. So this definitely adds an advantage, especially given that the college offers a Bachelor in the Art of Obstetrics. So the other things that were done is the simulation unit capacity has been increased significantly, and this was done by creating dedicated simulation spaces and the construction of a new control room in the hub and hiring additional technicians. And there was also an investment in faculty development, and there's a course of essential simulation that will be conducted soon that focuses on methodology. With regards to training on technology, we've conducted sessions on all the new mannequins, multiple sessions for all the involved faculty and for some of the hospital-based faculty as well. So this is just a picture of one of the simulation spaces in the hub, and we can see, well, we can partially see the control room. And this is a photo taken at one of the training sessions with Apollo, one of the new high-fidelity mannequins, and I think the problem with the picture is the timing of it. We're usually a little bit more active during the training sessions. So what does the future hold for simulation here? Now, there's a lot of faculty development opportunities, and as simulation technologies and methodologies advance, and a lot of research can be conducted to try and optimize the teaching through simulation. And there are also opportunities for industry collaboration, and our partners, our main partners, Leader, they're very responsive to our feedback, and they relay this back to the manufacturer, and they really take that into account when they're designing new simulation mannequins. With the mannequins that we recently acquired, there's a lot of room for introducing postgraduate training in simulation as well, for procedural skills, for decision making, particularly in anesthesia, and advanced airway training, and so on. Given that a lot of universities around the world and in the region are recognizing that simulation is going to continue to play a huge role, this may offer an opportunity for collaboration with regional and international simulation centers. So I just want to conclude with this. Sir William Osler 100 years ago said, "He who studies medicine without books sails in uncharted seas, but he who studies medicine without patients does not go to sea at all." And if I could offer an update, 2021 post-COVID update on William Osler's words, I'd just say that he who studies medicine with simulation fares a much better chance at sailing safely to their destination. And thank you very much.